health emergency as the country's hospitals are running out of medicines and vital supplies. In fact, doctors in Sri Lanka are advising people that don't fall ill or get into accidents as the country's economic crisis has led to short supply of medicines. Cancer hospitals are struggling to maintain stocks of essential drugs for uninterrupted treatment. Items like cotton socks for surgery, blood transfusion supplies, even cotton wool and other essential items are running short. The president of the Sri Lanka Medical Association has said that if things don't improve, doctors may be forced to choose which patients to give treatment to. And all this at a time when Lanka is recovering from the COVID pandemic. This is an extremely heartbreaking situation that's unfolding in our neighborhood, where doctors are asking people not to fall ill or get into accidents. I'm joined by Dr. Lakshman Ediringhe, who's president of Government Medical Professional Association of Sri Lanka. Dr. Lakshman, thank you so much for making time and speaking to Mirror Now. At the outset, I'm really sorry for what's happening in your country. It is actually heartbreaking to hear doctors say and ask people not to fall ill or get into accidents because there are no medicines in the country. For the benefit of our national audiences back in India, could you take us through what is going on in your country at the moment?
Yeah, I think this situation has been experiencing over the last couple of months. We have been telling the government officials that essential medicines has to be restored as quickly as possible. But some of the medications, certain surgical consumables, especially catheters, brain tubes, surgical gloves, and these items are in short supply right now. And some of the anesthetic drugs, used in the recovery, neostigmine, which is, right now it's a very scarce commodity, and also the blood bags and certain reagents used for laboratory tests that we do not find in, as a sort of a reliable supply. So we have been struggling these things, on top of that, our human resource management has also become a very critical issue due to the fuel crisis and, the patient transportation, as well as, our healthcare workers for their traveling and their transportation from their residences to the working places has become a serious issue right now. So in my opinion, country has to be brought immediately to normalcy. Otherwise, this situation cannot prevail. Ultimately, the total healthcare system might collapse if we do not find a solution within the immediate future.
Absolutely. Dr. Lakshman, I want to understand as an Indian national, because for any country, the healthcare is one of the backbones of any country because, of course, it concerns the life and death of a person. Today, what is the situation? As you said, that this has been going on for a couple of months and the situation hasn't changed. Since there is no active government, there is anger mounting against the Prime Minister. What happens if someone is critical in Sri Lanka at the moment? What options do these people have? Because now doctors are compelled to choose which patient to treat.
I think the situation is grave, but still, the healthcare workers, our healthcare professionals, from the medical administrators, the consultants, the general medical practitioners, as well as all the other categories of healthcare workers, they are relentlessly giving their, fullest cooperation with the authorities to maintain our situations in the hospitals. But, certain things beyond their control that cannot be addressed without the support of governance in the country. So the major issue, even though we are having short supply when it comes to critical supplies, still we have certain amount of medication, so we can, even for the couple of weeks ahead, we'll be able to, we do not have the luxuries as we had, earlier days, but still, in case of an emergency, we'll be able to handle it for a while. But immediately, I call all the political authorities in the country that they will have to cooperate with each other, both in the governance as well as in the opposition. They must, discuss and, bring some sort of, the consensual politics into being. Otherwise, the country will be in sort of a very danger, and the healthcare system might collapse, and already, the democratic process in serious danger in the country. As president of a professional organization, what I call these are politicians, both in the government as well as in the opposition. They must try to find, now I heard that, the speaker of the Parliament, he mentioned that, the Parliament is to be summoned on 20th of this month, but that is too late, the all Sri Lankan citizens, we urge our politicians, they must come together, call the Parliament as immediately as possible, and try to bring back the country's democratic process to normal. Then we'll be able to restore the health systems, as to its normalcy, back we had, couple of months back.
All right, thank you so much, Dr. Lakshman, for speaking to Mirror Now, and we really hope that soon things get better in Sri Lanka and that nobody has to choose between getting treated or not. Thank you for speaking to Mirror Now.
Thank you. Thank you.